It seems more and more folks are using that sort of product these days, but still the vast majority of people, and I suspect your practice would illustrate that, just choose, they get in their boats and they jump in their pools and they go to the golf course and they go to the beach and they're out in that sun. I saw an interesting little comment that said if your shadow is, how does it work? If your shadow is shorter than you are,
yes,
you're running a risk.
That's exactly right, because as the sun is higher in the midday, in the mid part of the day, your shadow will be shorter.
Very small.
And this was promoted by the Australian dermatologists who see even more skin cancer than we do. And so basically the rule is if your shadow is taller than you are, right, then you're supposedly in that safe sun. Mm-hmm. But if it's shorter than you are, that's that time from 11 a.m. to 3 p.m. when you really want to seek shade.
Does the time of year make any difference?
It does. When the sun is lower in the sky, it does. So
like winter time?
Exactly. You have less direct UV penetration and less direct rays. So it still can be dangerous, but it's less so. One of the most dangerous times is on cloudy days. Because what happens with cloudy days is the UV radiation that generates heat is blocked out by the clouds, but the UV radiation that causes skin cancer is not blocked. And so you can get, many people have had a bad sunburn on a cloudy day because they're not feeling the heat, but they're getting just as much sunburn rays.
Can we revisit the moles issue for a second here? You mentioned someone with 100 moles or so. Why are moles so much related to melanoma?
A mole is made up of, it's packed with melanocytes. And melanocytes are the little tiny powerhouses that produce pigment. And in a mole, you have a congregation of these little tiny pigmented cells all in one little area, and that's what gives the color to the mole. And when you have enough of these in one concentrated area, sometimes because of the sun or because of just genetics, one of those little tiny cells can go awry. And that's what happens with melanoma. Those melanocytes lose the ordered control that they have, and all of a sudden they just start producing these melanocytes wildly, without any control, and that's when we can evolve into a lesion that can spread.
And is it true also that if someone has had one melanoma, I suppose you count them that way, one melanoma, they're more likely to have more, just like with the basal cell? Absolutely.
There isn't a hard number for that, because again it varies quite a bit, but I tell their risk for developing another one certainly is higher compared to someone who hasn't had one at all. I obligate them to look at themselves every single month, do an exam. They see me in my office every 6 months, and if they notice any mole changing or different, I will get them either in the office that day or that week to examine that changing lesion.
How long does it take once a melanoma develops, once it's discovered, for it to spread to the stage of perhaps fatalities?
Well, unfortunately, it can be very quick. It depends, first of all, on that stage we talked about. If it's a very early one, that's unlikely. It can show up again, but that would be something that usually would be many years down the road. But if you have an aggressive lesion that either had already left the skin by the time we got to it, that can show up a month later as another lesion, either in a lymph node, which would present as a bump or a knot where you have your lymph nodes in the groin or the axilla, or as a mass somewhere else in a solid organ, or it can present as a new bump around the original excised melanoma site. So one of the first things I do when I see a melanoma patient that I've removed a melanoma on is I go right to that melanoma site and I examine that area in its entirety to make sure that there's nothing new showing up around that lesion.
Well, the information is obviously incredibly helpful. People do need to be more aware of it. They do need to take better care of themselves. I now have to go find myself a dermatologist. so that I can get exams, and so on and so forth. Any suggestions?
Hey, right here.
Dr. O'Donohue, we thank you for being with us. We appreciate the information.
Great.
And we hope to have you back and cover some more topics related to dermatology.
Thank
It
you
is
for
very
having
important.
me.
Thank
Appreciate
you.
it.
Thanks for joining us.